May peace be on all of you. Myself, Dr. Majid Khan, Associate Professor, Loknetya Dr. J.D. Pawar College of Pharmacy, Kalwan, Nasik. In this video, we discuss about the sulfonamide, remaining part of sulfonamide. In previous two lecture, that is in lecture 1, we were cover history, classification and SAR of sulfonamide. In lecture 2, we were cover mechanism action, bacterial resistance and importance of pK value in sulfonamide. Now in this video, that is in lecture 3, we will cover about the combination therapy or combination sulfonamide called as Cotrimaxazole, IUPAC name of important sulfonamide and uses of sulfonamide. The learning outcome of this topic: after completion of this topic, student able to understand concept of combination therapy of sulfonamide, draw the chemical structure of important sulfonamide with their IUPAC name and uses. Now let us start combination therapy called as Cotrimaxazole. So actually it is a combination of two drugs, that is trimethoprim, in short TMP, and sulfamethoxazole. So this Cotrimaxazole is a combination of two drugs, trimethoprim, that is TMP, and this one is sulfamethoxazole, which is a sulfonamide category. So it is a structure of TMP and sulfamethoxazole. The synergistic effect achieved by combination of sulfamethoxazole and trimethoprim recognized by major advance in the field of chemotherapy. Bacteriostatic activity is observed due to inhibition of two prominent steps in bacterial enzymatic pathway which involved in folate synthesis, as we discussed this in lecture 2 in mechanism of action of sulfonamide. So sulfamethoxazole inhibit utilization of PABA in the formation of dihydrofolate, while trimethoprim is a potent and selective inhibitor of enzyme that catalyzes conversion of dihydrofolate to tetrahydrofolate. This synergistic antibacterial effect is observed due to double sequential effect on bacterial metabolism. Originally, trimethoprim introduced as anti-malarial agent. So this drug trimethoprim, originally it is an anti-malarial drug, but also show significant bacteriostatic activity. This trimethoprim is effective against most of gram-positive and gram-negative organism. In case of sulfamethoxazole, it is a sulfa drug. So sulfamethoxazole was selected from systemic sulfonamide class on the basis that it has similar pharmacokinetic feature, that is rate of absorption and elimination, same as that of trimethoprim. So from different sulfonamide, sulfamethoxazole is chosen. Why? Because this sulfamethoxazole having approximate similar pharmacokinetic property as that of trimethoprim. Therefore, sulfamethoxazole co-administered with trimethoprim in a fixed dose 5:1 ratio. So it is a dose ratio, mainly 400 milligram plus 80 milligram of drug. This ratio yield fairly constant plasma concentration of sulfamethoxazole and trimethoprim as 20:1. So the dose of these two drugs is 5:1. sulfamethoxazole 5 and one is trimethoprim. So this dose ratio yield the plasma concentration 20:1. This ratio is found to be most effective concentration range to exhibit synergistic effect against most of pathogenic microorganism. The trade name of this combination, that is Cotrimaxazole, the trade name is Septran, Bactrim, Cotrim, Sepmax, etc. So it is available, this Cotrimaxazole available in market under these trade names. Now uses of this combination therapy. So this Cotrimaxazole used in acute otitis, means it is an inflammation of ear. Second use, meningococcal infection. Third one is nocardiasis. So it is a bacterial infection by Nocardia asteroid species, mainly affecting lungs. Next use, Salmonella and Shigella infection. So it is the name of bacteria, Salmonella typhi and Shigella infection. It is also used in typhoid fever. Next use is brucellosis. It is a bacterial infection, generally transfer from animals to human being, and generally symptoms include muscular pain and night sweating. And this combination also used in bronchitis, that is inflammation of bronchi. So these are the uses of this Cotrimaxazole. Now we say about the individual important sulfonamide structure and their IUPAC name. The first structure is sulfacetamide. So it is a structure of sulfacetamide. So it consists of acetamide. This one is acetamide group attached to this nitrogen. So IUPAC name N. N means this N means this N. 4-aminophenyl. So this is a 4. This one is 4-aminophenyl. Sulphonyl means this group sulphonyl and acetamide. So it is a acetamide. So the IUPAC name of this drug is N,4-aminophenyl sulphonyl acetamide. Next drug, that is sulfamethoxazole. So here sulfamethoxazole, isoxazole ring is attached. So again 4-amino means this 4-amino. N means this N. 3,4-dimethyl. So here number is given from oxygen 1. This one is 2. So it is a 3,4-dimethyl isoxazole. It is a isoxazole ring. On 5th position of this isoxazole ring is attachment, that is 5-eel. Benzene, this one is benzene. Sulphonamide, it is a sulphonamide. So IUPAC name 4-amino N 3,4-dimethyl isoxazole 5-eel benzene sulphonamide. Next drug, sulfapyridine. As name indicate, it contains pyridine ring. So it is a pyridine heterocyclic ring. So again here there is a 4-amino. This one is 4-amino. N-pyridine. So here N-pyridine. Second position attachment. 2-eel. Then benzene. This benzene and sulphonamide. So IUPAC name total 4-amino N-pyridine 2-eel benzyl sulphonamide. Next drug, sulfamethoxazole. So this drug contains this pyrimidine ring. This is a pyrimidine ring. So again name same 4 position amino, 4-amino. Again N here is on 4th and 6th position there is a methyl group. So 4,6-dimethyl pyrimidine. This one is pyrimidine ring. 2-eel means this 2 attachment 2-eel. Benzene sulphonamide. So total name of this sulfamethazine is 4-amino N,4,6 dimethyl pyrimidine 2-eel benzene sulfonamide. Next drug, sulfadiazine. So here sulfadiazine, again it contains pyrimidine ring. So IUPAC name 4-amino N-pyrimidine 2-eel benzene sulfonamide. So it is a IUPAC name of sulfadiazine. Next drug, sulfadoxine. So again it contains pyrimidine ring, but here it also contains methoxy group on 5th and 6th position. So IUPAC name again 4-amino, this 4-amino N, this N, 5,6 dimethoxy. So here methoxy group is attached. So 5,6 dimethoxy pyrimidine 4-eel, this attachment 4-eel benzene sulfonamide. So IUPAC name of sulfadoxine is 4-amino N,5,6 dimethoxy pyrimidine 4-eel benzene sulfonamide. Next drug, sulfasalazine. Sulfasalazine. So here you see the numbering, that is 1, 2, 3. So here is 1, 2, 3, 4, 5, 6. In this ring 1, 2, 3, 4. Here also from nitrogen 1, 2, 3, 4, 5, 6. So first 3. 3 means this 3. Then 4. 4 means this 4. N means this N. Then pyridine means this pyridine. So first you give the numbering from left to right. So 3, 4, N, pyridine. Then on second position pyridine is attached, 2-eel. Then this group is sulfamoyl. This ring is phenyl. Diazenyl. Di means 2. Zen means, aza means nitrogen. So diazenyl. Then here on 6th position hydroxyl group, 6-hydroxy. Benzoic acid means this phenyl ring with acid group, that is benzoic acid. So here first you give the numbering from left to right, and then give the name of group from right to left. So the total IUPAC name of this drug is 3, 4. So this 3, this 3, this 4, then N, this N, then group is pyridine, 2-eel, sulfamoyl, phenyl, diazenyl, 6-hydroxy benzoic acid. So it is the some important sulfonamide. Now general uses of sulfonamides. So mainly sulfonamide used for UTI, urinary tract infection. Next use is for intestinal infection. For example, sulfaguanidine drug is used for this purpose. Also used for ophthalmic infection. Example, sulfacetamide. Mainly eye drop or eye lotion available for ophthalmic infection. Next use for ulcerative colitis, UC, ulcerative colitis. Example, sulfapyridine. Also used as a in case of nocardiasis. It is a TB-like infection. Then also used for RTI, respiratory tract infection. Example is Cotrimaxazole, that is combination therapy. Then otitis, that is inflammation of ear. Example, sulfa drug with erythromycin. Erythromycin is an antibiotic. Then also this drug also used for dermatitis, that is inflammation of skin. Example, sulfapyridine. Then next use in vaginal infection. Example, sulphonamide. Then infected burns. Example, silver sulfadiazine. So this silver sulfadiazine available as in cream or tube for infected burns, that is infection due to burning. Then Sulphonamide also used in meningitis, example sulfadiazine. And the last one is conjunctivitis, that is inflammation of eye, and that sulfacetamide and sulfadiazine used. So it is the general uses of sulphonamide. So in this lecture, by this lecture we have finished sulphonamide chapter. So if you like the video, then subscribe to the channel. Thank you very much.